I'm Karen Turk, glad to be here. I'm with the Esther 414 Foundation. We are working with coronavirustownhallmeeting.com, and we're looking forward to bringing you these meetings tonight from Naples, but from all over the country, providing you with local resources for our national pandemic. And I'm really glad to be able to bring you those local resources in partnership with the Naples Bay Resort. I want to give them a big shout out and a thank you. They're actually open for first responders and medical personnel at this valuable time for the local community. And we're looking tonight to provide you with local resources within your community, including virtual testing. If you're having symptoms, it's very important that you get a telemed appointment. And we're going to be demonstrating one of those this evening tonight on this live webinar. So we look forward to bringing you that. I'm also going to be introducing some very important people who are acting as community resources during this time. We're going to be joined by Dr. Lizette Bonanno, who's working with the Esther 414 Foundation. We're also going to be hearing from Chris Woodcock, who is a first responder, and also Dr. Benjamin Abbo, who is a medical doctor who's going to be providing you with information on the virus, what precautions you can take, and we're also going to be fielding questions. And I want to remind everyone to go to www.gotoflu.com for more information after this broadcast. It's very important that we stay safe, that we take care of each other, and that we spread the truth, not the virus. And with that, I'd like to turn us over to our first guest, community leader, Dr. Lizette Bonanno, who's with the Esther 414 Foundation. Welcome, Lizette.
Thank you so much, Karen, and good afternoon, everybody. So I am Dr. Lizette Bonanno. I'm an ambassador for the Esther 414 Foundation. I'm a modern-day Esther, committed to use my voice and influence for good. I'm here today to share with you valuable information about your local community and how you can get the help you need. The purpose to this town hall meeting is to help us conserve valuable resources and learn how to spread the truth and not the virus, as Karen had stated. You will learn more about testing how you can get access to medical staff later on this segment. There are several food pantries available to the residents of Naples and surrounding cities or counties through the Catholic Charities organization in Naples. I will provide you with the Catholic Charities phone number for your county, and they will direct you to your closest food pantry. For the residents of Sarasota, Manatee, DeSoto, Hardy, Highland, you may call 844-385-2407. For the residents of Lee, Henry, Glades counties, you can call 844-385-2423. For the residents of Collier County, you may call 844-385-2404. If you need any prayer or want a guide on how to pray or like the listing of community information shared here today, please visit our www.esther414help.org. Thank you so much. Please remember to spread the truth and not the virus for such a time like this. Back to you, Karen.
Chris Woodcock. He's working on the front lines of this crisis. He's a first responder in our area. And again, thank you to the Naples Bay Resort for staying open and housing first responders that are coming into town and need a place to stay, along with vital medical personnel in the Naples area. Chris Woodcock is on the front lines. He's watching this crisis unfold, and he's going to give you valuable information about telemed, how to get a telemed appointment, and also what he's experiencing, 911 calls, things that are happening in the community, and explain to you what you can do and the precautions you can take. Welcome, Chris.
Very much. So my name is Chris Woodcock. I'm actually going to take my mask off. I don't have anybody around me that I have to worry about exposing. I'm way within 6 feet of distance. 30-year paramedic firefighter from Seminole County. One of the big problems that we have encountered that I want to make people aware of is that, and we're going to get more involved with this as Dr. Benabo talks as well, but we think what's going on is a lot of people are calling 911 that don't necessarily need to be calling 911 for specific symptoms. If you've really got a bad problem as far as, very extreme difficulty breathing, chest pain, something like that, something very emergent, then by all means, you need to call 911, excuse me. But kind of touch base on the whole first responder, firefighter, paramedic thing. Where I work in Seminole County, and this is probably happening, well, it is happening all over the country, but we had a group of guys that were exposed to a person who they ran on quite a bit. He was what we would refer to maybe as like a frequent flyer. So they're running this guy probably every other week, a couple times a month. But he has a history of he has COPD. And COPD is a respiratory problem, and this guy was always having issues with it. Very problematic COPD. So when they went on a call for him, they assumed that what they were going for was COPD related problems. They transported him to the hospital. Not really at this point. This was early on in the COVID-19 scare, and they weren't taking the necessary precautions. At least not all of them were. And turns out that 9 of these firefighter paramedics that were exposed to this gentleman all had to be put on a 14-day quarantine from work and from their families. So while they're at home or wherever they went to, they had to be away from their loved ones, wives, kids, moms, dads, neighbors, brothers, sisters, whatever it may be. They're having to isolate themselves, and when they are around them, basically gloves, mask, the whole shebang, whatever is going to keep everybody the safest. So again, the idea is trying to keep people from unnecessarily involving more people to have the potential for more exposure. Again, if you feel like it's an emergency situation, you have to call 911, then by all means, that's what we want you to do. But please think about what you're doing. And with that being said, I'm going to turn it over back to Karen, who then is going to turn back over to Dr. Abo. Thank you very much.
Thank you so much. I like hearing the stories, and I think it's so important to remember, that you are on the front lines and you're seeing this. And again, thank you so much. It's very important too that we get these telemed visits, and I know Dr. Ben Abo is going to talk to us a little bit about what he's experiencing as a doctor, and also how you can get tested virtually, over the phone or computer from your own home. And this is so important for all of us right now. If you're recognizing that you may have some symptoms, you're not feeling well, you don't need to leave your house. And there are ways that we can do this virtually. And Dr. Ben Abo is here, and he's going to tell you a little bit about that. Welcome, Ben.
Thank you very much. It's good to virtually see you again.
You too.
So I am an emergency physician. And let me get this. I'm hearing a little echo in my earpiece. So I'm an emergency physician and an EMS physician. And there's certain fears that are out there, just justified and rightfully so. This is something that we shouldn't be in denial. That's a big problem. It's also something that we shouldn't be too fearful of, because there's just essentially information that we all need to stay safe and to do the right thing. And that's what this is all about, getting the right information out there. The information that gets around, having wrong information is actually just as damaging as the correct information. So there's a few things that I really want to get across. Number one, if you're having an emergency, whether it's viral related or not, any type of emergency, and you need to be in the emergency department, yes, go to the emergency department, call 911, do those things. But if it's just a fear that you're kind of sick and it's kind of a fear that you might have coronavirus or COVID-19, then you can absolutely get a hold of your doctor, or with us, we'll help you get in touch with the doctor that can help make the right decisions. And it's not just about getting tested and, okay, now I'm positive or I'm negative, now I can continue on with my normal life. No, we have to continue the social distancing and everything. But you have to understand that only if appropriate do we need to get the testing. And if it is appropriate, we can get you that appropriate testing. And then how do you interpret the results? Oh, okay, so you're positive. Oh, so you're negative. What do you need to do from there? Oh, you have other people at home. So we're trying to put you in touch with the correct people to make the right education and the right educated choices. So all you really need to do, if you can't get a hold of your doctor, or if you don't have a doctor, and it's not an emergency, like you're not having trouble walking down the hallway because you're so short of breath, then absolutely you can go to the website, get set up, and HIPAA compliant, be all set up with the telemedicine. And again, if we feel the need and the ability to get the testing for you, we will either send the test kits to you or tell you where to go to get testing done. And along with that, as I said over and over, I like to be repetitive and redundant for certain things if I find it important. It's you get the right instructions and the right information so you can interpret it, because there's a lot of bad stuff out there. With that, I would love to answer any questions that are out there. I know a big one is, do you need to wear masks in public? And what about gloves? The fact of the matter is masks are very important. I only pulled mine down so that you can see my face, unlike my patients directly right now. And because I have nobody within 6 feet of me, actually it's at least 14 feet. And basically what that does is really help protect you and help protect others. I can use any kind of cloth mask. I use the N95, those things like that, higher filtration when I'm at work, because I'm putting myself at risk. I get higher viral loads or anything like that. I need to protect myself. But for the public, for going out, my firefighters and paramedics at the station, going to the store, absolutely should have some sort of mask. And it could be the homemade mask, it could be a handkerchief, it could be what I have here. But I do want you to realize that it can't be a false sense of security. It's not 100%, but it'll absolutely do a lot. And you can't be touching it, adjusting it and all. Really, you should be holding it from the sides to pull it on and to pull it off, because otherwise you just negate everything that you're trying to do. As far as gloves, out in public, you really don't need them because you're touching everything. And I keep seeing people literally with gloves touching everything, and then they open a bag of Doritos and then they're eating right from that, or they're licking their fingers to count money or something like that. All that just completely negates what you're trying to do. But masks, absolutely. Even when we hit the supposed peak, we don't know how long that peak is going to be. We're going to be in a social distancing and everything that's working for quite a bit here. I don't know exactly how long, but it's not just a couple of more days or a couple more weeks. And so you have to do the right thing so that we can continue on doing the right thing, supporting commercial different things around us, and at the same time taking care of each other.
Doc, we have a bunch of questions coming in.
Up?
Yeah, we got some popping in on social media. And I know you mentioned the one about gloves, which is interesting. But we have another one, too, where someone's asking if they can re-wear their homemade mask, or do they need to trash it after each use?
That is a wonderful question. In terms of the homemade masks, you don't have to trash them. You can wash them. I reuse this. I have different ones that I use in public, and I just wash them. Just like you would any other clothes, the same as I do when I get home from work and I wash my clothes. You can just wash your homemade masks.
That's great. Another viewer is asking, I think there's a lot of misconceptions about this. How exactly does the coronavirus spread from one person to the other? We're hearing so much about surfaces and breathing and aerosols. Can you explain that for this viewer?
Sure. Basically, this virus can live in droplets. And the problem is that these droplets can spread in various ways and be on the surface. So if you're running and someone happens to cough, those droplets are still in the air, they can get on you if you're walking by. Obviously, if someone sneezes on you or coughs on you, that's a problem. They touch their face and then they touch a surface. Not the bacteria, the virus is alive still on that surface, and then you touch it and you get it. The other thing is it's alive or able to spread on different surfaces for different amounts of time. But for the most part, it's contact. If you happen to inhale something, then it is more airborne, but it's not necessarily airborne unless it's aerosolized. Now, things that would make it aerosolized is if I'm doing different medicines, breathing machines, things like that. And that's why the healthcare providers, the paramedics, the EMTs, the respiratory techs, we need that higher filtration, that N95 or N99. But the general public doesn't need those things. You can use inhalers or even do breathing treatment outside in better isolation, and then it won't spread.
I got a great question right here. I have somebody who's asking me about, they have a CPAP unit and they're on a CPAP unit. And when you're talking about aerosols, they're wondering whether or not that puts them at any more risk, being that if they're sick and they're using this, will it spread it to their households? Is there some special sanitary precautions they need to take with that unit?
In terms of, that's a wonderful question. In terms of the actual unit itself, it kind of depends if it's a full mask, if it's just the nasal one, and different things like that. In general, I would definitely follow the instructions in terms of how to clean it, do a little bit of vinegar every so often to clean things through. And if someone is showing any signs of illness or sickness, whether they think it's coronavirus or not, I would do my darndest to isolate when I'm using that machine. So for instance, if I'm using a CPAP and I'm feeling a little ill, whoever I live with, I'm going to try and sleep and use that in a different room. And I'm going to clean everything around as needed, because there is the chance that it can help spread it, because that's one of those aerosolizing potential things.
Yeah, and how about too, we have another viewer who's asking, how do you differentiate between seasonal allergies and coronavirus? And they want to know if they're more at risk if they live in a shared apartment with shared ventilation. Is that air conditioning or that shared ventilation going to be a risk for them?
Two great questions. First, before I even answer them, I want to point out that when we talk about higher risk or high risk communities like the elderly, immunocompromised, or those with comorbidities and sicknesses, that means they're at high risk and higher risk, but that doesn't mean that the young and the healthy are not at risk. So everybody needs to do what they're supposed to do to try and prevent the spread. Okay, so with the question about telling the difference between seasonal allergies, it can be a little tough. That's why I'm actually quite in debt financially to go to medical school. And that's why you need medical professionals to help you figure this stuff out a little bit, not just go by Dr. Google or things like that. However, if you have a fever, it's not allergies, that's for sure. If you're truly short of breath, it can go either way. For me, I have certain seasonal allergies and environmental allergies, and I absolutely sometimes have trouble breathing. I cough, I sneeze. So it can be pretty difficult for the layperson to tell the difference between it, but that's another great opportunity to, if you're not super sick, to use telemedicine or talk to your doctor. With respect to the shared air, that absolutely is a risk. So everyone should be doing what they can to isolate, at least as a household or a family. But if someone in that family is sick or further exposed, you really need to isolate them more. And the same kind of things as when going outside, do inside. For me, if I got sick at work and I came home, I absolutely would either live somewhere else or I'm going to stay in a room where only I'm in that room. I'm the only one using that bathroom, doing different things like that to help isolate myself. It's not always easy to say, just don't go home, get another apartment. Who can afford that? So do what you can to do isolate and things like that. And the CDC, and also locally here with the Department of Health and Collier County EMS, there's instructions and guidance on how to guide and take care of somebody that is sick, or if you think you're sick, even if you're not necessarily needing to be in the hospital.
I have another question too here from someone that's asking about an elderly parent. And I know in Naples, we have a big elderly population there in Collier County. And they're actually asking how somebody who's elderly can get a telemed visit. Is there some way to facilitate that if you don't have a smartphone or a computer? And I thought that was a great question.
That is a terrific question that need to kind of look into. Because this is set up so that we can do it. I would say in the meantime, if their family member can help set them up or get them a phone or something, or the internet, that's a wonderful question. Because part of the beautiful thing about the telemed that we're trying to get people into and all is so the physician can still see you and so
Mhm.
you can see them.
And I'm wondering if a group FaceTime call would work for something like that. I'm wondering if I should respond and say maybe a group FaceTime call. Do you think that
That
that would work to
potentially would
facilitate
work,
this?
absolutely. That potentially would work as long as that patient is okay with somebody else being on the line.
Excellent. Excellent. And how long can this virus survive on a solid object? You know, there's been a lot of talk about it can survive longer in your freezer. I don't know if you have any answers on that, but I know we're all looking at how do we bring our groceries into the house safely? How do we desanitize things as we bring them in? What's your policy on that?
Great question. So my policy is to do whatever I can to negate all the potential things. There is some great studies out there already that tell us on copper it lasts this long, plastic this long. And in general, I can tell you that on metal and hard surfaces, it lasts a lot longer, even days, several days. On clothing, it does not last as long, but can be several hours at least. So I keep that in mind. When I come home from work, I actually don't even get in my car without disrobing and washing down. But who's going to do that every time you go to the parking lot or the supermarket? You don't need to. I'm putting myself at risk differently. Now, for my groceries and everything, if I can, I'm using paper bags because paper doesn't transfer as much. And I have the ability before I go into my house, in my garage, to take everything out of the bags and I can give everything a wipe down before I even bring it into my house, before I bring it into my refrigerator or anything like that.
That's great. And, you know, there's been a lot of questions too with, you know, there's been a real run on people buying disinfectant products, and we've all had a hard time getting some of the staples, whether it be bleach or alcohol. What are some good ways that you can disinfect if you can't get bleach or hand sanitizer or any of these other things that seem to be in short supply?
So it was funny when all the things started and it was so quick that hand sanitizer seemed to disappear, but I had no trouble bulk ordering bars of soap. And soap and water does a lot of wonder. It actually works very well. Whether it's washing your hands, washing different things, laundry detergent, things like that. It's actually usually all the same types of products, but there's a little bit of changes, whether kind of like you don't want to put dish detergent in the washing machine if it's meant to be in the sink, because then you flood everything. And I did that at the fire department once. That was embarrassing. Bleach, even one jug, you don't need to hoard it. A giant jug goes a long way. It would probably last you a very long time because you need to dilute it so much. It barely needs to be concentrated. So what I would do is I would go to the CDC and the WHO websites for specific guidance to know the different recipes, so to speak, in terms of what's going to work, what's not. Don't listen to what somebody posts on Facebook just because it's on Facebook. Oh, this would work, or wintergreen or lavender. Go by the science. Make sure the source of information is correct. I know that a lot of emergency managements for different counties are also putting out vetted information regarding products you can use, whether it's acetacetic acid or vinegar, things like that. So use the right sources.
Great. And there's a final really simple question is, how do I know whether or not I need a telemed visit? How do I know that, you know, is it as soon as you experience symptoms? When is it appropriate to ask for that telemed visit?
Really, anytime you're feeling ill and you're having any doubts or you're questioning things, but it's not serious enough to go to the emergency department, that's when I would consider a telemed visit.
That's great. And I know you mentioned the CDC website. I have a question here. What other websites are there? What was the second website you mentioned? I know you said CDC.
I mentioned the
there's
WHO, the World Health Organization,
Okay.
but also the Department of Health.
And is the Department of Health, would that be different for every area, or is that a national website?
It's by the state.
Perfect.
Now,
Great.
different counties and their Department of Health do work differently with the county emergency management. So there might be also some sites and information there. Honestly, it all usually goes right back to the same information, the State Department of Health or the CDC.
And once they have the telemed visit, how do they get the actual test?
So there's a couple ways that it can happen. If you do the telemed visit and we determine, yeah, it's a good idea for you to do the testing, then either we'll set you up with where you need to go with an electronic prescription so you can do the drive-through testing, or we actually have the ability to, for a certain number of kits, we can have the kit mailed to you and then you do the swab and then send it back.
And how long does that process take?
About 24, 48 hours.
So someone will know pretty quickly if they actually have the virus.
Correct. And even more importantly, they'll know what to do with that information.
And what would somebody do if they do test positive? I mean, obviously they should be isolating themselves as soon as they have symptoms, but if they do test positive, what is the course of action at that point?
It really depends. They definitely need to be further isolated and further quarantined and keep a lookout for severe issues coming down the road. So everyone should already be on the lookout if they're getting severely short of breath or really, really sick. But this is somebody that I would keep an even closer eye on. And these are also the people, if they're known to be positive, that I'm really making sure that they are socially distancing and isolating, quarantining more appropriately so they don't get myself or somebody else sick.
Great. And Tess is actually asking, I think it's a great question, what type of symptoms indicate that I should go to the ER versus getting a telemedicine appointment?
Anything that really severely worries you. If you're really short of breath, having chest pain, more than just, oh, it kind of hurts. I'm talking about shortness of breath where you can't even get down the hallway and it's significantly worrying you. Those are pretty good signs that you probably need to go to the hospital. If you're breathing more than 30 times a minute, you're probably really sick. That's kind of it. It's that balance. It's a big gray area.
And another question we're getting, which is a great question, is telemedicine only for adults, or can somebody have their child get a telemedicine appointment?
As long as you're human, you can get a telemed appointment. I will say though that for the most part, a child or an infant, or really an infant or newborn, it might be harder. So you might start a telemed, but we might have other concerns of what's going on. So you might want to really see them in person.
And also another question is, are certain over-the-counter medications better to use for COVID-19 if it's a mild case and you need something over-the-counter? I know I heard something, I'll elaborate a little bit on this question, about using Advil versus using Tylenol. Is there anything there that we should be aware of?
No, they're just different medications. Advil is the same as ibuprofen, which is the same as Motrin. That's an NSAID, a non-steroidal anti-inflammatory. Tylenol is more of an antipyretic and a pain medicine, a little bit anti-inflammatory things. And part of what we're worrying about here with COVID-19 is inflammation. So it's that balance. For the fever itself, you can do either. I tend to use Motrin for my inflammatory issues.
That's great. And I want to remind everybody, when we wrap this, that information is available on www.gotoflu.com. And if you're watching this and you're anywhere else in the country besides Collier County in the Naples area, you can actually log on to www.coronavirustownhallmeeting.com, and you can look for other meetings within the local area where you are or where your friends and family are throughout the country. And if you see that there's not a meeting in your area, we can actually help to get a meeting set up and facilitate those meetings for you. And Dr. Ben-Abo, we're going to be seeing you all over the country. I'm going to be moderating these things with you on the go forward as the national moderator for the Esther 414 Foundation, which is a group of women volunteers dedicated to serving our local communities and our sisterhood all over the world. So thank you so much, and thank you to the Naples Bay Resort and Marina. I think what they're doing there, not only for us, but for the first responders and medical personnel, allowing them to stay there and staying open for them is amazing. And thank you so much for their hospitality today. Again, www.gotoflu.com or visit coronavirustownhallmeeting.com for our future meetings. And I'll look forward to seeing you again, Dr. Abo, and all our other wonderful guests that we've had on here.
Yeah, thank you very much. I look forward to it, and I appreciate you helping us spread the truth and not the virus.
Absolutely. Spread the truth, not the virus. See you next time.
Bye.